strong advocate for this for all the right reasons, as you have pointed out, in terms of kind of the dual use infrastructure and the training. There is a very clear recognition that throughout Indian country, certainly in my state of Alaska, the lack of law enforcement presence, whether it is at state trooper level or tribal police officer, I think we recognize that there are far, far, far too many communities that are either unserved or underserved.
And huge distances. Right?
Huge, huge distances, and many challenges as we understand. I just have a couple more questions for our witnesses this afternoon. And I want to go back online to you, Ms. Fine-Day, because you raised the issue of 4B and the 477 agreements. I have long been a supporter of 477s that really allow for a much better coordination of services. But we're seeing that our federal agencies are increasingly limiting access to 477, particularly at Interior. But I think what you said, I think you said burden in administering 4Bs. Can you just speak a little bit more to the committee here about why strengthening 477s through the cross-departmental coordination is really key, and giving it that flexibility that allows us to better address the child welfare challenges that we see across Indian country?
Yes, I would just say, so I'm sure you know this better than I do. 477, it started in 2000, in the year 2000, and it allows tribes and tribal organizations more flexibility in funding. And then it was expanded in 2017 to include 12 departments and that became eligible to be included in these 477 programs. And the BIA is the lead agency in developing these 477 plans. And there are currently 67 tribal plans, 477 plans in 18 states. And what 477 does is it reduces paperwork, it consolidates services, it focuses on client needs, and it uses existing funding more efficiently. So it's taking programs that are operated, and I don't have the names of the federal agencies in front of me right now, but the Children's Bureau and ACF is currently not one of the programs that participates in 477. So in expanding 477 to include the Children's Bureau or ACF would allow, could possibly allow tribes to access 4E funding and 4B funding through a 477 plan. And you could combine that into the 477, and it would transform tribal child welfare, I believe, and it would also form a component for family stability, and would support cross-training, and could just really transform the services that are available in Indian country, because most tribes are not able to access that funding at all today.
Thank you for that. I want to direct a question to you, Ms. Jump, and this is about FIPSA and the importance of reauthorizing that. They're still getting appropriations, but it has not been reauthorized since 2015, and it lacks the statutory authorization for tribal and culturally specific services. So that's one of the reasons why we've included these provisions in our discussion draft. Can you speak a little bit more about why it is important that we have clear authorization for tribes and culturally specific programs. I mean, I think there's no dispute um, about the need that our children have for these services that are more culturally connected as they're facing their trauma. But we've been there. You have some who say, well, you have money that is still being directed to FIPSA, so the reauthorization is perhaps not as key to that. But can you address that piece of it? Because that's another piece to this bigger puzzle that we've been trying to put together.
Yes. So
Wait. No, I'm sorry, Ms. Fine Day. I had directed this to Ms. Jump.
Oh, I'm sorry.
Okay.
Sorry.
Go ahead.
Okay, sorry about that.
That was confusing. I thought you were talking and I didn't see your mouth moving. It's pretty amazing.
I was throwing my voice.
Yeah.
Actually, as you know, FIPSA is the major funding source for domestic violence shelters, tribal or state coalitions, and national resource centers. For the past 40 years, they've been doing that work. And it was last authorized, as you mentioned, in 2010. And so it's been expired now for 10 years. Advocates have been working on reauthorization without success, which is probably the biggest reason why I'm so excited about this proposed legislation. You know, as you said, Congress has continued to provide funding, but without authorization, the funding really is at risk. As you know, just last year, the Unauthorized Spending Accountability Act was introduced, which would have reduced appropriations for unauthorized programs over a 3-year period, resulting in eventual termination. Advocates across this country were terrified, not just in Indian country, but across the country, because this funding provides such critical services, right? Shelters, when somebody is seeking safety, and they're so far and few.
There were 65 shelters
There's
total?
No. So across the country, there are about, I believe it's 354 shelters. In Indian country, there are 67.
67 throughout.
67 throughout all of Indian country, serving 575 tribal nations. And so, you know, we were terrified, right? And everybody was holding their breath until, you know, we found out that, okay, yes, we were going to maintain some funding. And, you know, that feeling is not new across Indian country, right? I think that's one of our biggest risk about programming is that, you know, funding will come out and we'll be able to establish programs and then funding goes away and we lose them. And so there's always a risk of programming that is not authorized of being cut. And that's just, you know, tribes are already underfunded and under-resourced. So our communities know that as sparse as these services are, that funding is critical. Further, I think that what really is important about, you know, reauthorization is that it reflects a commitment, right, to survivors. It reflects a commitment to survivors that they are seen, they are heard, and that they matter. That, you know, we will continue to support these programs that are so critical, that are life-saving. And that commitment is important, you know, for all of our survivors.
Thank you for reinforcing that. I wanted to ask you a final question, Councilwoman Johnson, and you spoke when you were talking about missing Native children. You also recommended that we ensure that this includes non-custodial family abductions, and I think you kind of underscored why that was important. But I guess I'd ask you to expand on why why these contexts are significant to include in our legislation, why it's important to have the information from BIA and DOJ to help you to respond to the needs. I think sometimes we want to focus our legislation, but you've reminded us that oftentimes these non-custodial family matters require us to look more expansively at that definition.
Thank you for the question, Chairman Murkowski. Missing often involves complex family dynamics. When a child is taken by a non-custodial family member, it's sometimes dismissed as a family dispute rather than a disappearance. Including these cases ensures that the children don't fall through the cracks of the legal system. Regardless of who took the child, the result is the same. A child is missing from their safe environment. We cannot ignore the role of substance abuse in child safety. When drug activity is involved, the risk of the child increases dramatically. By tracking cases linked to drug activity, we can identify patterns and hotspots. This isn't about criminalizing families, it's about understanding the specific dangers like trafficking or neglect that our children face so we can intervene faster. Currently, information is often scattered. Having a unified study that coordinates with the National Center for Missing and Exploited Children means we aren't starting from scratch every time a child goes missing. For a rural family like Fort Belknap, seconds matter. Real-time coordination data between federal agencies and NCMEC gives our local law enforcement the tools, alerts, and resources that they need. And a lot of times, like I said, when law enforcement responds to these calls, seconds matter. And if we're understaffed with law enforcement and they're at another major call, trying to prioritize which one's more important, and you only have one officer on, it makes a big difference in saving someone's life. Thank you.
Thank you. And I want to thank all of you. I know that that what we're developing has generated a lot of interest among colleagues here on the committee. We've seen that as we have engaged in the outreach, seeking input not only from members of Congress, but more importantly, out in Indian country, really trying to take the recommendations from the commission and put them into actionable items, actionable legislation, but trying to be most responsive in a way that acknowledges the cultural implications, what we want to do to build on best practices that have been developed, not because we in Washington have drafted something and said it's going to be this way, but because it has been more organically built, more responsively built, based on traditional practices and ways of knowing, ways of learning. And so we respect that, and we want to see that reflected in this legislation that we will ultimately introduce. So I think it's fair to say that you can anticipate more questions from colleagues. We'll hold the hearing record open for an additional 2 weeks. And before I close, I want to acknowledge not only those of you that have participated, but there's been an extraordinary amount of work that has been done by the staff of this committee. My team has been extraordinary in what they have done and in working with the ranking member and other members as we have tried to engage in field hearings, listening sessions, and really trying to build on what we hear from you. So I thank the teams for your work and all that you are doing. I know we've got a lot more to do before before we move forward with it. But my hope is that with good input across the spectrum, from Republicans to Democrats to more rural areas to urban Indians, that we do develop legislation that is responsive to the need in a way that we are all proud of. So I thank you all, and with that, the committee stands adjourned. And we say happy birthday to Sam today, too.